we did just take Parker swimming at Fiesta Island last weekend, and then he was like wobbly legs for like 2-3 days after, because it was the first time he ever really got into the deep part and swam with his little corgi legs.
What is he, like, mix-wise?
He's a lab corgi border collie. So see the spots on his little legs?
Yeah.
That's the border collie. And then he's got a giant lab head and body, but then he's also part corgi.
Which is why he's a little short.
He's just a dwarf. You know? He's too big for his body. But I was thinking, are you wobbly legs today?
Yeah.
19.5 and then a 15K. How smart was that? Tell everyone.
I'm pretty sore today, but at least it's muscle soreness. So
someone would call
that's
it
a good
that.
thing. I ran the whole thing without training.
And without stopping?
And when I say no training, I haven't even been working out that much in general, like CrossFit.
Yeah.
But the total mileage that I've put in running was in 2 different CrossFit workouts where it was 1 mile each. So I ran a total of 2 miles in the last 3 months, and then I just ran 9 miles yesterday after doing the CrossFit Open workout, 19.5. So my legs are dead. I'm pretty much.
You taking the week off?
No, I'm gonna do like FixFit things and upper body stuff.
Yeah.
Core work, I guess you can say. But the whole run, what saved me was the sled work I did the day before.
Oh, smart.
So in our WOD shop class, which we're doing some FixFit stuff, we're learning how to push the sled with our glutes.
Mm-hmm.
And through that, I realized that if you kept your knees bent a little bit more and not hyperextend your knee to fire the hamstring only, then you could get the glutes to stay more active.
Oh, okay. You guys were walking a little more upright with it, it looked like on the video you posted.
Because I think when you start training, you become more hamstring dominant.
Yeah.
Especially in CrossFit and weightlifting, right?
Yeah.
But the glutes seem to still be deficient. They don't work. Mm-hmm. So knowing running, I was trying to focus on getting my glutes to stay active, so then my body, like my shins, my arches, and my knees don't take a beating. So I was like trying to apply the sled work to the running. So I think that's what saved me.
Nose breathing?
I didn't have time. My goal was to do nose breathing to work on the nervous system thing, but since I've had zero training with it, I didn't want to mess with that.
The hills kind of debunked that pretty quick. We ran the hot chocolate. I did the 5K, Mark did the 15K. I hated every minute. I hated every minute of it. I hate running. I got to the hill, and I was luckily running with Monty, and he's like a gazelle, and he was like, I gotta stop. I was like, oh, you gotta stop? I was pushing it real hard because I was trying to keep up with him. He's like, let's just walk up this hill. I was like, that sounds good to me, man. It's really early. I'm so tired.
The 15K is a whole different experience because you get to people watch, and being so in tune with mechanics.
Yeah.
It's amazing that so many people are tackling this feat. 9 miles is no joke, right? But the mechanics that I saw with the run was mind-blowing.
Yeah. Imagine if you went to every gym and watched everyone do 19.5. It'd be even better.
I don't know, but running such a big, I don't know, there's like how many people do you think were at that race yesterday?
My thing said for the 5K, like 5,600.
See, that's
just for the 5K.
That's crazy because there's not, no one, they're not going to get an event that big for the general population to come together to do like a CrossFit workout.
Shout out to Marie. She found out Saturday night she was going to do the 5K. She got 4,000th and 88th place out of 5,600.
4,000.
I was like, you're an elite runner. This is a pretty good pace. 18-minute pace. Not bad, I think her and we were walking a lot of it. I'm sure this week we'll see a lot of people with some lower back complaints now. I already saw, oh man, that was another good thing. I was walking around after the race and I saw some girl point to the front of her hip saying, this hurts really bad right now. And they probably have no idea what that is. But she's pointing to her psoas, hip flexors, from a 5K.
I think a very common complaint is going to be low back pain.
Yep. That's probably what we see the most in my office. Since I'm a chiropractor, we are the back doctors, right? So, man, I'd say 75% at the minimum is what I'll see with lower back pain. And like we were talking earlier, even if someone comes in with a shoulder, neck, headache complaint, I'll ask them, how's your lower back? And they'll at least say, yeah, it's stiff, tight, achy all the time. I sit a lot. So I always look at the lower back too. But I kind of base my whole clinic around the SI joint, and I'll get into that later about why I think that's important. The like SI joint complex.
That's good too, because I have no idea what that means. But go ahead.
SI joint complex, yeah, that's a big word. But what we were talking about is we see mostly is chronic lower back pain. Just it's never gone away. They come in and they just know it's been bothering them for a long period of time. But we still see it with an acute flare-up, which means that they had something recently that kind of flared it up a little bit, and then they just don't know how to make it go away.
So what you're saying is they're not going to complain about it until it hurts that bad.
Yes.
But they've been dealing with low back pain
for
living
a long
with it. Time.
Yeah, they're living with it. It's always stiff. It's never releasing.
At least you get the honest answer, because they're coming to you, a doctor, chiropractor, and they're going to tell you about their pains.
Right.
Whenever we have walk-ins, and whenever I talk to new people, I always ask them, hey, do you have any injuries that we should know about? And most of the time they hide it because they think it's common. So it's not their fault. I don't really think they're hiding it, I guess. So when I ask someone, they're like, well, not really. And then I go, okay, well, do you have pain in your knees or shoulders? Does that ever bug you? And then they go, oh yeah, kind of. Sometimes when I do this, but it's okay. It's not injured.
Right.
And I was like, what about your lower back? It's almost like I'm digging. I have to get the truth, because they're like, oh yeah, I sit all day, my back's always tight. And I'm like, that's an injury.
Yeah. Micro injury over time.
But it's so common that people just think you just live with it. That they're at this certain age and they're like, I have back pain. It's part of the process. I become 30, 40, whatever, and now my back should be tight.
Right.
It's almost uncommon, right, to have like no low back pain.
Yeah. I mean, I'll always have patients come in that say like, my lower back hurts and I want to get it fixed. And they go, and I look at their intake and it says 2 out of 10 pain. So there was not that one big injury that brought them in, like some people, where pain's that motivator to bring them into a chiropractor. But they still are, like you're saying, they're just living with it all the time, and they finally something in the past week or month where they go like, I just got to get it looked at. I got to know where it's coming from. That's what they always say, right? I want to know what's happening inside of there. What's
they want
happening.
The labels, right?
Yeah.
Like, is it sciatica? Is it? I don't even know all the other ones. But they want to know what it is.
Yeah.
So they can cope with it.
If I had a quarter for every patient that says, I think I have sciatica, and they point to the back of their hip and they say it kind of just shoots into the butt a little bit. I Googled that. It said butt pain, sciatica. I'm like, no, true sciatica. You want to talk to a pregnant lady in her 3rd trimester with sciatica down to the back of her heel. That's true sciatica. Burning, shooting pain down to the back of their heel. And we can provoke it with almost any kind of movement where your torso's going to flex, where you go to hip flex, to walk, and then it starts shooting. So there's specific tests that I have that I run through in my office with any of my patients structurally that can aggravate the sciatic nerve, and I've rarely seen it a positive true sciatica. It's usually a pregnant woman.
That's why it's usually the back pain is not that bad.
Right.
But that's why a lot of people don't say shit, because it's a level 2 out of 10. 3 out of 10.
It's in their head like all the time, and we talked about that last week, where they're so sensitized to it that like they just can't stop thinking about it all the time, because what are they doing all the time?
Sitting.
Yep.
That's what we're trying to do with movement, right? So that level 2 to 3, for them it's not that bad, because they can get through 8 hours a day at a computer with some basic standard treatment. Rest it a little, maybe go on the YouTubes, right? Find a stretch or two, and then it does relieve it. They roll around
WebMD, dude.
That always leads to cancer, so don't do that. Your back pain just turned into some sort of cancer. So when they look online for some pain in it, and it's like they can take care of that 2 to 3. But the problem that we see, I think, is when adults find a hobby, an exercise routine that they like, a sport that they like. So that 2 to 3 is a big deal, because your foundation is fucked. So you're applying, your body with the 2 to 3 back pain. Now you're gonna go and try to learn a deadlift, because you see all these people deadlifting now, or you're doing CrossFit and you're doing a bunch of burpees. I kid you not, one of the biggest low back injuries we see are from burpees.
What about
they hurt? I think burpees hurt more lower backs I wouldn't say more, but just...
I haven't tagged you in the Ben Bernoro thing about burpees. He doesn't prescribe them to his clients.
One thing is, it's never the movement. I get where that guy's coming from because you send it to me.
Yeah.
He's saying that burpees are bad for you, and there are parts of the burpee that can be bad for the shoulder and the lower back.
Right.
But it's really then how you perform the movement.
Right.
So if you're activating the right, again, you check the movement first, because if you love to do burpees, our mission is to make sure that you keep doing the burpee.
Nobody loves to do burpees, but
that's maybe one person, Dave Marchand. We call him Robot, but he's the only person I know that actually likes burpees.
Shout out to Robot. Yesterday at the 5K, he sprinted past me, and he was trying to walk it with one knee. He was one-legged. I said I would chop off the other leg, and I'd still put you at 5-1 odds to beat me. At that 5K, he sprinted past me and Monty, and I was like, Robot! And he looked over, I was like, you're supposed to be walking!
Yeah.
And no, he didn't stop him. He's like, the adrenaline got me. Hopefully he's not limping today, but yeah, that's the only guy that would like burpees. But the other day, we did a WOD with a lot of burpees. What was it? And you went over the push-up thing, where keeping your pecs firing so people's lower backs wouldn't hyperextend. I did that because I usually get, my lower back gets tight at burpees too. I do that traditional hyperextension of the lower back to get up, and then I sit my hips back and I shoot them back, but I don't keep my core tight. So you just said keep your pecs firing the whole time in that push-up position, and at least protect your upper back neck, and that helped me a lot, and I wasn't that sore the next day.
Well, it's just when you cobra up, right? When you're pushing your body up out of the bottom of a push-up for the burpee, because no one's coming out of a burpee with a strict push-up.
No.
Right? Not that I've seen. Usually you'd have your hips on the ground, and then you arch your lower back to push your body up. If you keep your pecs on, at least your pecs are taking some of that weight, so you're not putting all of that weight into a low back bend, right? It's really just trying to push your chest up and all the weight's in your lower back. So when you're flexing your pecs, even though you're protecting your shoulder, you're still taking some pressure off of your lower back.
It's weird because actually I'll feel it in my low back while I'm doing it because of that reason, but I always tweak my my neck into my neck, and then my triceps, like Murph. I'll just do like a bunch of tricep burpees or push-ups.
The force has to go somewhere, so
right.
That's why we do movement assessments, because for your burpee, every time you're pressing up, it disperses and goes into your traps. Mm-hmm. Some people in the lower back. So
I feel it in my lower back too. It's just like my chronic neck issue is the thing that will take all the force, like you said. That's where the force transfers.
So that's going back to the main topic. It's that the people that everyone deals with low back pain as an adult, in my opinion, just because we've been sitting so long. Mm-hmm. Or just being sedentary, right? We're not active. And then it gets worse when you start exercising.
Yep. And why though, right? So that's where when you see Mark or I for a personal assessment of yourself, we'll tell you the why it's happening. So let's say I do get somebody in my office and they're somewhat athletic or somewhat active, and they have that chronic lower back pain, 2 out of 10, but recently it started flaring up and they want to tackle it and they want to figure out what's going on. I start off by assessing range of motion slightly. I mean, if it's a 2 out of 10, they're probably moving okay, just their lower back erectors are tight, right? Their QLs are locking their hips up. And so I'll look at it that way, just like a visual assessment of how they walk in, how they get out of the chair, because when we see an acute flare-up where it's like disc pain, they're not moving very good. So I could kind of see their inflammation levels just based off their intake form. 2 to 4 to 5 out of 10 just means this kind of just sucks right now. 8, 9, 10 out of pain, 7, 8, 9, 10 out of pain, and nerve pain, radiating pain down their legs, numbness, tingling somewhere. That's a more major trauma injury, car accident, weightlifting injury.
But you get probably things. How many? You probably get more people that have that like 4 to 6 range, right?
Mm-hmm. I have way more people with that 2 out of 4. And I tell them, if you did come in after a car accident or a weightlifting or a sport injury, we're having different discussions, right? We're just saying, how do we get your pain levels down before we get to the next step of where it's coming from, right? Because we can't even get to that. Where's your true range of motion at? What's the true, all we know is the mechanism of injury was car accident and I got this leg pain, okay? get all the inflammation out of there first, make sure there's no disc injury, then we could look at the structural, stability of the hips and the way that they're moving throughout the day. But for now, we have to just get the inflammation down, and then their pain levels go down. So when somebody does luckily come in just 2 out of 10, I love that kind of a patient, because I'm like, I already think I know, and then we take like a brief history, and I'm like, I already kind of know what's going on. I just want to find out what you're doing throughout the day and what you're doing at night at the gym or in the morning at the gym that's making it worse.
What is the main, when you ask them, because I bet we both ask the same question,
Yep.
What are you doing for this pain? What are the most common things you hear? So standard options out there, right? That's the most common thing. Everyone deals with it. So they probably, like, what do you hear from your clients?
Anybody that's ever talked to some kind of healthcare provider, it's rest, it's ice, it's ibuprofen, and maybe some stretching. And what stretches? Are they stretching their hamstrings, their hip flexors? Maybe if they're really educated about it or a former athlete. But for the most part, it's more like I lay on my back and bring a knee over my chest or a knee across my chest and do like a little supine twist.
Child's pose or something in yoga.
Yeah, they Google it, They'll look at a YouTube video, 5 best stretches for low back pain, and that will temporarily get you feeling better, moving a little bit better that day. But what happens? They wake up the next morning and they're like, I'm all stiff and all inflamed again. So
that's why they come see you.
Right.
Or they bring it up to me, is because they have tried. I think it's rare that someone has a low back pain that's, 2 or 3 out of 10 and then goes straight to a chiro or straight to a trainer.
Right.
Usually they've tried multiple things. They've, got a foam roller, they got a lacrosse ball, they've done these exercises and stretches.
They went to PT in the past and they knew
they were referred to PT. Mm-hmm. And that's usually the standard care.
And if you go to a PT for chronic lower back pain at Kaiser or Sharp, they get shown heat, stim for your therapies, and then stretching and foam rolling. Yeah, so they'll try those first to kind of mediate it, and then it's like, it's still there. Something's still structurally there. So that's where chiropractic care is so good. I tell them, like, even the American Medical Association will say, chronic lower back pain, chiropractic care should be your primary choice, because there's no drugs, there's no there's not a lot of rest, there's an active treatment plan, but that treatment plan to chiropractors is the taboo area, right? For me, it's like 4 to 6 visits would be nice, just to make you feel a lot better, moving a lot better. But the actual studies show like 12 visits. If you're not like out of pain, moving better, then you need to get referred to something else.
So after 12 visits, if it's not better?
Over 4 to 6 weeks, yeah, it should be better. So your chiro is not doing anything if you're not feeling any change. In my opinion, if you're not feeling any change in like 4 to 6 visits, I'm like, we got to look into something else. But I look at it from so many different directions. But the true chiro side of it, just manipulating the hips and lower back, that's different.
We've even shortened it from our experience working together. It's like 1 visit.
Yeah, like 1 or 2, honestly.
We'll talk about that in a second, where it's like you do 1 assessment and then they go to me and then we start working right away. Yeah. So the thing about the standard care that we're seeing now, not just standard care, but when people are looking for help, they go online, they go on YouTube, they look for the exercises, they start buying all these products. There's more and more products now, and supplements for pain relief.
What did you say about Dr. Oz? What did he say?
I just looked it up. I was hanging out before the podcast today, getting coffee, and then I just wanted to search on YouTube. I just typed in low back pain, and the top video was Dr. Oz, and then he had three solutions for it under 60 seconds. That's his slogan. Yeah. And then 2 of them were supplement based, which was weird. He was like, put this supplement cream on a towel, on a cloth or something, and put it on your lower back. And then the last one was like actual stretch or something.
Yeah, I'll tell you what's under 60 seconds is an adjustment. It's like literally under 60 seconds. It'll get you moving and feeling better quick. But this is the side I like to argue against chiropractors, right? Because we argue this all the time, that I don't even like my profession sometimes, because what is the spinal manipulation that you're doing? The first place I ever worked, my mentor, or whatever you want to call her, boss, said, adjust my L2. And I said, why? And I feel like I may have been the first person in her life to ask, like, why would you want that adjusted? I just, like, that was my natural reaction. I was just like, why? She's like, I have a PL on my L2. Did I get it to move? And I was like,
what's a PL?
It means that your L2 is rotated posterior and to the left. I don't even know how to. I haven't talked like that since school, so it's like I don't even really remember, because I don't talk subluxations like that, right? So I told her, okay, like, let me show you the move I could do from school, and she was just like, I don't know, I didn't really feel it moves. So this is where the asshole in me comes out. I go, okay, can you do it to me? And me being the size I am, her being the size she was, she couldn't. I mean, I couldn't even feel anything happening, like not even the slightest pain. And anybody that's ever been adjusted before has been adjusted like this, has probably experienced this if they've seen multiple chiropractors. That person didn't get a damn thing to move. And it's like, why? So she brings in another guy. Here, you do it to him. And I'm like, yeah, something popped in there, but like, okay, maybe you got my L1, L2. You don't know. You're just throwing a force into my lumbar spine and hoping something cracks.
I was just going to ask that. Can you find exactly that one point, pinpoint?
He set up there and got something to crack, and he's like, see, there you go, man. And I was like, dope, dude. How do you know that was my L2? And why does my back hurt even worse now? Because it's all spasm and like releasing in that area. When I was like, I don't even have back pain. We're just kind of practicing on each other, but that's a.
But how do you know that the L2 is the problem?
Exactly. So I said, here's my philosophy on it. Your SI joints, right? So your SI joint is sacroiliac joint. Okay, so your sacrum's your tailbone. Everyone knows what their tailbone usually is. But when they think of tailbone, they think of that thing you could fall on, that little tail end of the bottom of your spine.
That's not your tailbone?
That is your coccyx. The sacrum is above it. So it's actually like right, if you just went to like the middle seam of your pants, right at belt line, that's your sacrum. It's a hard end feel. Okay. You have two iliums, your hips, or people like to call it too, that rotate about that axis of the sacrum. They go forward and back. They're very, very, very small though, like a millimeter of nutation is what it's called, like this, right? What I've seen and what one of my professors taught me in school is that one side would kind of be stuck or restricted, and then the other side becomes hypermobile just because of the way that we put force into our pelvis when we sit or when we walk. Am I losing you?
No, I'm listening.
So one side's stuck, like let's say my right SI joint is stuck, my left SI joint's looser because of it, and then the sacrum's kind of just getting abused in the process, like on the right side. It's inflaming over there. Okay, so that was my thought process coming out of school. I could move this right SI joint, I could adjust your left hip and get everything loose that way, and then everything above it, like your lumbar spine, just let it operate on its own. And it worked well for me in the beginning.
Because you saw it more as movement, right? It's not like, because you're probably targeting the SI joint thinking that this controls the hip.
Right.
Is that kind of your mindset? Because it's like you're talking, I guess the difference for you from what I'm hearing is that like that lady's focusing on L2.
Right.
Like what the hell is that
That's
L2 function?
Low back.
That's a low back. But you're thinking SI joint because the hip does everything we do.
It's funny, we're in the room right now that actually has the skeletal system right here, this little poster. It's so archaic, this poster, but I kept it because there's a center of gravity line that points right into the middle of the sacrum. And I love it. I show people it all the time. And if you look at the hip joint, the ball and socket part, the line goes right through there. So that's where you should be hinging from, basically, right? So
not your L2, not your lower
not
back.
your L2, right? So I'm like, so people might be hinging from their L2 when they sit for a long period of time, and that's the problem, and that's where their pain is coming from, right? Tight erectors, tight lumbar spine, restricting their range of motion. But the center of gravity needs to be down lower. So I started shifting my thought process, and I still adjust that way. I want one SI joint to move. I want the other side to... I'll go into a weird chiro tangent on that, but I want the hips to move, right? But where that's transitioned into my movement patterns is I look at the actual hips and ball and socket and how it's controlling the pelvis, which is the ball and socket is the actual hip. Your ilium, which people always point to, like this, like that's their hip bone. That isn't really a source of pain, but that is where the glutes are. Right?
Yep.
So you have the glute starting from your top of your ilium, and it goes to the back of your hip, right?
Mm-hmm.
So,
well, going back to like basic understanding of anatomy now, right?
Right.
Because all that can get too complicated.
Yeah.
But at the end of the day, it's like, do you still have pain in your back? That's where I'm coming from, because a lot of times you'll do these standard treatments. You go to a chiro, you go to a trainer, whatever. You do these stretches, and those are the people who we're really talking to. Because if for some reason it worked and you don't have any more back pain, then great. But the problem is you've tried all these things, you tried all these stretches, and your back still hurts. And I think the issue is that, like what you just talked about, to sum it up, is that people feel the pain in their lower back and they try to treat that. So they think the pain is in the L2 region, your lower back region. So they're going to try to strengthen that, in my world, do a lot of back extensions, because that's where your pain is. You need a stronger back. In your world, you have pain in the L2 or whatever in that lower back range. You must adjust that. Mm-hmm. And to you and I, it's like, that makes no damn sense.
Right. And that's where we started working together. Was I've always worked on SI joints and hips and saw good results. And you have too, by which you'll get into in a second, with glutes and hamstrings and hip flexors. Why were we both getting success with people is because we weren't looking at the lower back anymore. We were looking at what's controlling the lower back, which is the hips and the pelvis, right?
Step one is always the pain relief. So when people are looking online, they don't want to be in pain, so they get the stretches, the massages, the SMR, like the lacrosse ball foam roller. And then after that, they're afraid to start exercising or moving again, or they don't want it to come back. So they look for lower back exercises. And I've Googled or YouTubed this, right? And a lot of it is what they define as core work, right? But the problem is that they don't define what part of the core they're training. They just say core, right? So one of the big things that we're going to talk about is the hinge, and making sure that they're using their hips, and that's where I'm trying to tie into what you just discussed, is your hip is actually the joint that should be moving for functional movements and not your lower back.
Right. So like I said, I could see someone, I tell them, you're feeling better now. You're still hinging from your lumbar spine, not your hips. What the hell does that mean? I try to tell them in my office structurally, do a functional squat right here real quick, just a freestanding squat, no weight on your back, and they're doing that. They can't move, they can't initiate any movement with their hips. That's where I say, I think you need to talk to my buddy Mark and get a movement assessment. So let's say I got that 2 out of 10 person. I mean, they still 2 out of 10 to a 0 out of 10 is their goal for me to get them out of pain. They're not looking for just the pain relief. They're looking for, okay, I'm moving better. Now what? That's where you come in, right?
Well, that's where the people look on, after their pain's gone, they look for the exercises on YouTube. It's like they do these core exercises. They do these bird dogs, planks, bird pickers, all those common back extensions, hollow holds. You might be getting stronger. You probably are. You're working out. Your muscles are being developed. But through all the process, it's still, no one's talking about movement yet. So for us, it always goes back to what movements were you doing that caused your back pain? And if you don't check that off in the assessment or even just discuss it, then you're going backwards. So you could do all the stretches in the world. You could rest all day long. And then you could do all these core exercises. Then you go back to doing what you love to do, which is powerlifting, CrossFit, whatever, high intensity exercise. Zumba, or yesterday, right? All the runners, they can take a break because they're sore as hell. They can stretch their back and their hip flexors. They can do these core exercises. They do another long run, and then their lower back's going to flare up again.
5,600 people yesterday, 5K. What do you think they're all doing today? What do you think 75 to 90% are doing today?
Limping around. No, but they're definitely looking for some sort of pain management.
Do you think they're going in the gym today? Any gym?
Probably depends. If you do the 5K, probably, but 15K, I think everyone's pretty broken. Unless you're unless that you run all the time, right?
Yeah. I bet you a lot of them are just taking today off.
ibuprofen is probably
a lot
spiked.
of ibuprofen.
Yeah, a lot of people.
CVS is flooded right now. We're out of Advil.
And that's the whole point, is that no one's fixing the fucking problem.
Yeah.
Maybe you have back pain every time you do a long run, or just do a run in general because you're running fucked up. Think about that. And that's what I'm realizing watching people run and trying to help buffer it so I don't get, an injury from it, is I was trying to focus on mechanics the whole time. But watching a lot of the people run where they're rotating at their torso and they're shrugged up, their toes are pointed out, and they're...
Here's a good point too that you've taught me in the gym too with running mechanics, which nobody's ever talked to me about running mechanics before, which is crazy to think about. If I've been on multiple sports and multiple coaching, and like no one's ever just gone over what actually happens when you stride, but everybody's using their hip flexors, right? You have to run. So if that's their primary source of pain the next day, they're just like, oh man, this is part of the sport.
And the hip flexor, right, you could break down like what muscles are we talking about? Psoas, quad. But with those,
there's a lot of muscles that flex your hip. TFL.
And then if you're using those smaller ones, they're meant for stabilizing. But if you're using that, let's say psoas or TFL, your hip flexors, to lift your leg up and push it all the way forward in a stride for 9 miles, that's not going to work because those muscles are going to give out. So at some point, mile 3, 6, halfway, once those things give out, then it's all lower back, knees.
Here's why people's hips are shifting around and why their lower back's shearing. The psoas muscle goes from your L1 on the front of the spine to the front of the hip, right? So it's literally pulling that spine forward every time you flex it up. Mm-hmm. So if, like you just said, it's a perfect way to say it. If that's the only muscle you're using, your low back's going to hurt the next day, right? Mm-hmm. So stretching that muscle out is not going to relieve your lower back pain. The action of the psoas, it's actually a stabilizing muscle for your lower back. It's anti-extension, right? So if you're flexing it over and over and it's not giving you that anti-extension of you rounding your lower back, then you're just going to get that front hip pain the next day and lower back pain the next day, like in your QL. But again, people think that's the cause, so I need to stretch the hip flexor. No, you need to stabilize that hip flexor. And how do you do that? You have to turn on bigger muscles to shut off the smaller ones. And that's why I show people kickbacks, which we've kind of coined that now. I just have patients stand up all the time. Stand up, squeeze your glutes together, kick one leg back. My patients listening right now are probably shaking their head. They've heard it just way too many damn times from me. But it's just amazing to me still that if someone has like an actual flare-up of their lower back, and then I tell them stand up, squeeze your glutes, kick back with your right glute, they'll use their hip flexor even while they're putting their hips back into extension. They'll kick back with their right leg and go, my back, I could feel it in my back. You could see it too. And I'll make a video later to show what it looks like. They're arching their lower back to kick back. And I tell them, you're fighting gravity right now, not a hill on Golden Hill.
Yeah.
That was like a mile up yesterday. So imagine what's going to happen when you're running up a hill. You're just arching that lower back to get up the whole time. Of course your QL is going to take over, right?
And that's why it's not the exercise. It's not the even stretch. But if you're doing a kickback with the wrong, you can do it with the wrong muscles.
Yeah,
that's
exactly
the whole
right.
point. And I've been making videos of the like live assessments that I've been doing last week on my Instagram, and it's showing people that it's not just this one drill. I have this band drill, and we want to simplify it, right? Like you use this kickback, and if you do it right and you're using the right mechanics, it can be that easy. Because so many people that you told me have had success with that kickback, but they have to use their glute to kick back, not their lower back and their hip flexor.
Right. And the glutes are triplanar, right? So the top of the glute is going to bring your hip out. Then the glute max is going to bring your hip into extension. But that bottom part of the glute, that inferior part of the glute, will really help someone get up that hill, right? So I'll tell them when they do start getting, I think I feel it in my glutes now. I still review it in their subsequent visits because I encourage them to stand up and just turn on the glute at work, right? So if your job is to sit in front of a computer for 8 hours, I'm like, stand up every hour and do this kickback. Fire your, what I hope is your glute max, but I'm like, palpate, press into, like you love to do, like dig into that glute inferior part. Can you fire that muscle when you kick back?
Can you flex it?
Can you flex it?
It's
never.
That's a discussion that I have all the time, and a coaching point we use at our gym is that All right, here's the analogy. If I say to everyone listening right now and to you, it's like, hey, flex your bicep. Easy. That's everyone knows how to do that.
Hiding this from the camera.
Yeah. It's funny I say that. I don't have really big biceps. I wasn't blessed that way.
Yeah, me neither.
It's all in the quads. But everyone knows how to flex their bicep.
Mine's all in the glutes.
It's all in the
all in the cakes.
We should shoot the video at a different angle. Just standing.
We can. We'll shoot that kickback video later. Everyone's going to be signing up for birthday cake with Cook. You know what I'm saying?
So when you have access to flexing your bicep, that's great. But that, like, the bicep only has certain functions, right? But when we're talking low back pain today, we're talking glutes, which is the biggest muscle in your body.
I've stolen that from you because I always tell people, do you know how many muscles it takes to flex your bicep? Deltoid flexion, pec minor up here, and then the bicep will flex. Maybe even some of your wrist extensors are firing. All of those, and then they go like, whoa, all that's happening. When I tell you just to kick back your glute max, think about how many muscles have to shut off in the front of the hip. Think about how much the glute needs to recruit. It's not going to happen overnight. You got to work on it, and you have to have the right intention behind your exercise, which is something I get to have you for.
That kind of debunks that whole, like, you can train each individual movement or muscles, individual muscles, right?
Yep.
Like you talked about
arm day, back day.
Yeah, I'm only hitting the biceps, right? But for me to do a bicep curl, depends on which type. We talk about that later, but you have, like, for us, we try to fire the pec first, and then we try to fire the short head of the bicep second. But you can't have one without the other.
Right.
You know. So the glutes are a big part of your hips, and you should be able to have control of them, just as you should have control of your bicep. And that's the problem we've been seeing, is that people are moving and they just can't fire that muscle. And that's kind of the main point, is like, you can't fire your glutes and then you expect to run up this hill.
Right.
Good luck. The hip flexor is going to take over, because that's the only thing your body's just doing naturally. And you don't want to kind of rely on chance or luck. Like, hopefully my glutes will work when I start running.
And you and I both know the way muscle mechanics work. So we know that if you are flexing your bicep, it's the muscle, the tricep needs to shut off during that, right?
Well, that's actually a myth as well, because and I've learned this through from Julian from StrongFit. So here's a quick test to debunk that right away, because you have to test it. You can read all the research papers or whatever. Grab a really heavy dumbbell, like your 1 rep max bicep curl. Thank you. Try it, and then you'll probably stop halfway because you're fatiguing. You can't curl it. When you do that, you're gonna have a chain of muscles that are working, and you're like, right now I'm doing this curl, right? I'm just flexing, like, imagining.
Yeah, people could try this right now.
Yeah, flex so you flex your bicep and keep flexing. Stop at 90 on your elbow, like the dumbbell's too heavy to curl. Right now my biceps on, my pecs on, and also my tricep.
Your tricep's stabilizing right now.
So it's still on. So that whole mindset.
But it's not doing the primary action of extending the arm.
But that's what I learned in college, right?
Right.
It's like, all right, because it's an agonist, that shit. It's like, when your bicep is on, your tricep is going to turn off. But it doesn't turn off.
Right. What we try to teach people is, like, if we're extending back the glute max, your hip flexor is shutting off, or is it stabilizing now? Kind of like your bicep tricep. That's the way we try to relay it. And if they don't get that, I always tell them war of attrition. I love to show people, you have the 2 chains thing in your gym. I have, like, a big red muscle man in my office. I just love to show them, look at the hip flexor, look at the glute. It's war of attrition. If you feed that glute max, it's way bigger than that psoas, and it's in a better spot for you to control, right? The psoas is always on and stabilizing. You have no autonomic control of it. But your glute, you have control of it. So as soon as I'm sitting right now at the end of this podcast and my glute's shutting off, I could stand up and feed it, right? But I can't stand up and feed my hip flexor unless I go for a run. Yeah. And those two things aren't happening, so I try to tell people, like, stand up, feed that glute max more and more and more, and give it. It's going to win. It's going to win.
And kind of the take-home message, too, like a little nugget that you can apply right away is just, like you said, practice flexing and doing a kickback, and that's what you prescribe, right? Mm-hmm. I always tell people, too, use pain as your coach. So for your example, doing a kickback, if I were to teach that, if I'm having them do a kickback and they only feel it in their lower back, then that's a good, you have to use that feedback of that pain, knowing that that's wrong, and try it again.
I tell people that's your day one marker. Go from there. Remember this day. Remember this moment. And then we're talking about a week and see where it's at.
It's unrealistic. I say this in the gym a lot as well, is that people always ask me, am I doing this right? So if I'm running a class on kickbacks and then everyone's asking me, am I doing this right? They're not learning anything. And two, it's unrealistic because let's say you're trying to apply this to movement like running. I was like, no one's there to follow you every step of the way when you run or walk, and two, they can't feel what you're feeling.
Right.
So you can do the same movement, this kickback, or someone could run and they could feel it in their glutes and they're using it. Another person could be running and it looks exactly the same and they're using all hip flexors, lower back.
Yeah, I love that. You said that the other day, last week at the gym too. You're like, am I doing this right? I don't know. I'm not you.
I can't feel what you're feeling.
I can't feel what you're feeling.
We're doing push-ups that day and we're trying to get the pecs to fire and they're like, does this look right?
Yeah. People are so big about form. They can watch themselves in the mirrors at Choose or 24 Hour and just say, like, I keep my back straight. My patients tell me this all the time. My buddy watches me keep my back straight. My buddy makes sure that I'm keeping good form. I don't give a shit about your form. Where are you feeling it? Right? So if they're like, I'm watching my form, my elbows are nice and not, my elbows stay back and all this other crap that they like have just read about on forums, and they're doing a bench press, but I'm like, why are you here for shoulder impingement then? You're obviously feeling it in your shoulder. You're not feeling it in the big pec muscle. So it's like, stop going by form and start thinking about what muscles you're flexing in those movements.
That's been the argument, right? Or, where you have to justify what we're doing. And it's like, are you still in pain?
Yeah.
When you're benching, do you still feel that front shoulder pain? Okay, good. Then we can have a discussion about why it's happening. But you can't just hold on to that like, oh, I was labeled with this injury, shoulder impingement. It's like, what does that mean? It doesn't even matter. The two things that we need to get better at, in my opinion, as healthcare providers, trainers, whatever it may be, is we have to stop using shapes as our coaching cues.
Mm-hmm. Joint cues is what you would say.
Joint cues. So one is shapes as in, I made a yoga video. Someone on my Instagram was asking about a chaturanga. I think that's a pose, but it's really just like a push-up. But I had Leslie demonstrate like a perfect plank, and she looked hollowed out. That means her back was round, and she looked like she was in good position. But you can get there by tucking in your tailbone, bending at your lower back, and her glutes weren't on at all. So she can have that right shape where she looks like she's doing a perfect plank, but she's really not even targeting the right muscles that she's trying to get out of a plank, which is firing her glutes, lower abs, obliques, the whole deal. So shapes is a big issue. Same thing like you're talking about when we used to teach deadlift. It's like get into like 45. You should look like this angle. The bar should be here. The knee should be back.
Yep.
So shapes don't mean anything because you can put all the weight into your lower back or your quads or your hamstrings.
Yeah.
Like the shapes, we need to stop with that. Your elbow position.
Yeah. So people not watching, I'm smiling because I hear it. People not working out with Mark or I that just go to 24 Hour, I just hear it all day long. And Mark, unfortunately, doesn't get to hear enough of it from these guys. It's just unbelievable. It's like, I got good form, man. I promise. I'm like, man, why are you here?
That's always the issue. Is like, are you still in pain?
And then they go, it's got to be something else. It's got to be something else. And I'm like, that's why going off last week, if I give them a new stimulus, like a kickback, perception changes pretty quick. And then maybe they're feeling something else differently. So that girl in the Chattanooga or whatever the pose was called, if she goes and flexes her glutes next time and she feels something differently, she's gonna have a whole new perception of what she's doing and what the intention of the exercise was from yoga.
Just trying to get the pecs to fire. I mean, it's more about just a movement pattern, right?
Right.
So the other thing is we have to stop using joint cues, in my opinion, because the reason I'm saying this is just that we've tested it for so long and it just doesn't work. So people still get hurt. So on a back squat or a deadlift, it's like you've heard it before. People are still using it. It's like shoulders back and down, knees back, knees out, knees in, whatever. That's the argument, right? Hips back.
Sit back on my heels.
And the first assessment that I do for anyone is teaching them or watching them move is just have them demonstrate a basic body weight squat super slowly. And so when I watch that, people are taught, they know how to sit back with their hips now because YouTube, Instagram, or whatever, they've had some training. But when they push their hips back, they're trying to create that shape or using that form or technique. But most people that do that are bending at their lower back. So that's where they're having low back pain, is when they push their hips back, again, a joint cue, they're not using the right muscles.
So you think you're seeing people hinge at their hips, or trying to initiate the hip hinge now, but still using the wrong muscles to do it? Is that what you're saying?
Yep, because we're taught, and everything we are learning is how to move the joints. But what moves the joints? Muscles, right? So shouldn't we teach the muscles first?
Right.
That's like your kickback, for example. It's like if you made a video, and this is what everyone's going back to, that quick fix. Another thing that I looked up this morning is just low back pain, and the top 10 videos, at least like 8 of them, just says this is the quick low back fix.
Right.
It's like you have to educate people on the muscles first, because that's what they do. So if you made a video on the kickback, and if you don't describe which muscles you're supposed to use and which muscles you're not, then they can do that kickback wrong.
Right.
So it's negligent, I guess, in a sense. We're saying this kickback works to fix low back pain. If you don't tell them that don't use your lower back, you have to feel in the glutes.
So here's a good example. I just talked to someone recently that was like, I'm trying to get my glutes to fire on a squat, and I get a wide stance and I keep my glutes tight on the way down, and then I'm trying to drive myself up with my glutes, and I'm sitting back in my heels, is what this person told me. And I said, okay, you got this wide stance, and I'm picturing like a box squat, right? Like I'm sitting back, hip hinging back, glutes are getting under tension, and then like you've explained 1,000 times to me, the SI joints are locked in place, right? Which is what I tell people is a good thing. Your pelvis is stable as you're sitting back, hip hinging back, but then they eventually lose tension in that and go lower because they don't want to be on quarter squat gang on Instagram.
Yeah.
And this is what he's doing basically. He's like, I'm trying to get lower, 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 lower. He lost tension in his glutes, definitely in the obliques is what I'm trying to transition to, but he's still driving up with the glutes at the bottom of the squat, and his lower back is now shearing right at his SI joint, and he's seeing me for an SI joint sprain.
The problem with teaching glutes only on the squat too is that you have to understand that the body moves in chains, right? Or you use multiple muscles to perform a movement, like you talked about. When you just do a curl and you try to flex your bicep, a lot of muscles work with that, right? So then when people squat and then they try to focus on just use your glutes.
Parker's having puppy dreams right now. Hey, bud. He's running in his sleep. He's still swimming at Fiesta Island.
He's probably just as sore as I am.
He's like running the 5K with you, or 15K with you right now. You good, dude? Okay, so yeah, back to, let's say on that body weight squat, what muscles are you telling them to feel tension on when they start to sit back on their squat? Body weight, no barbell, no nothing.
So let's go over just the assessment, right? For me,
yeah.
I'll just go over from start to finish. Whenever anyone comes, especially let's focus on low back pain. You come to me with low back pain, I don't care what movement you're doing first. Like if you heard it on a deadlift, you heard it running, I just want to see how you move your hips. So then I'll have you do that body weight squat, and then I usually start from watching them from behind, because I can see in their spine or their hip. And I made a video of this, like a deadlift assessment, so you can check that out on my YouTube page. But when they're doing that body weight squat, I tell them to squat slowly, and then everyone still goes down and up pretty quickly. And I was like, slower, slower, slower. And then they're moving like an inch at a time, that slow. And what I'm looking for is to see if they're actually bending at their hip joint, right, or their lower back. And pretty much all the time, every single time, they're always bending at their lower back. And that's what I start to assess first, because now we have a starting point. And yes, I'm looking at the joints, but then once I know if they're bending at their hip or their lower back, then we ask the question, well, what muscles are you using? Because that goes back to the muscles again. So a lot of the times, like you talked about, they're loading, their erectors, things like that.
Quads, hip flexor.
Yeah, a lot of knee bending, which is quads, and they're
especially in adolescents that I see, when I tell them to do air squat in my office, they feel it in their knees or in their quads only. So.
And if you want to know the reason why, it's that we've been taught knees out, butt back.
Mm-hmm.
So I'm trying to simplify it. Give me a second here. When you go knees out, butt back, you're using the outside glute.
Mm-hmm.
I'm just using simple terms, right? You're using the outside glutes. And you could try that. You could push your knees out as hard as you can, push your butt back to squat, and go slowly. This is what I would do the reassessments to show them what that feels like. So yes, you are getting the outside glutes to fire, so you get some sensation. But the problem with that is that locks in your hips. Your hips cannot bend anymore. So that's what you're talking about with the mechanics and stuff. It's the glute med locks in your SI joint.
Mm-hmm.
Okay? So when you go knees out, butt back, outside glutes, lock your hips. And then the only way you can come down now, because your hips can't bend anymore, is with two things. You bend your knees or your lower back. And that's how people are squatting and hinging or deadlifting. So try that out. You can stand up, push your knees out as hard as you can, push your butt back as far back as you can. You'll actually feel that your hip is locked, and the only two things that are bending to get you down to that squat, your knees are going to bend, which is all quads, and then your lower back at a certain point. You can only bend your knee so far, and your quads stop, and then your lower back takes over.
Yeah, that's perfectly said, man. I mean, we can go into a bunch of different tangents with hip pinching, knee pain, inside knee pain, outside knee pain, foot pain.
Here's the big thing.
But we're just talking low back.
I feel that a lot of people are set up to fail because they're getting a false reading.
Right.
So you're selling a lot of bullshit because you are telling them to move fucked up, and then yes, there's so many things that you can pinpoint as a coach or whatever, or you're trying to sell a product or something, right? Or a stretch. If I got that same person to do that type of squat when they're locking their hips and they have to bend at their knees and lower back, they're essentially moving wrong. So if I did a video of that, like as a before, that's a false reading.
Mm-hmm.
That's snake oil. So what I do is I get them to use the right part of their glutes, the right part of the core, which we're probably going to transition next, and then get them to squat. Now we can actually see where they're starting from with the right mechanics.
Yeah, because, well, if they come to a chiropractor with pain, our goal is get them out of pain. So they got their goal. They go to the gym, I want a range of motion. Can I do these movements with full range of motion with no pain? No tension in my bad areas. They know not to get tension in their lower back when they're squatting or deadlifting. So if you could give them those joint cues, if I could get them better with 300 adjustments a year and you could get them better with knees out, they got their range of motion, man. But to me, I'm giving them a false reading of just rely on the adjustment for your lower back range of motion or pain-free lifestyle. You're telling them knees out, you at full range of motion, but we both know structurally there's nothing there, and you're just a ticking time bomb until your knee blows up or your lower back is in pain and all this other stuff. So
another temporary fix.
Right.
You get an adjustment, you feel good. You get a massage, you feel good. You get this drill that you get your more sensation in your glutes. It feels good.
It feels good, yep.
But what happens is through wear and tear or the intensity, like if you're running for so long for 9 miles, you might be fine doing a bodyweight squat, you might be fine doing a 135 pound squat. You get to your max range or your 90 to 100%, you can't squat like that, not without shearing your lower back or knees.
Right. And we've talked a lot.
So it's not a fix.
No.
It's just temporary bullshit that people are getting fed, and because they want to get that insta result, like, oh my gosh, I do feel in my glutes great.
Right. And then that's the thing is, like, we can get people to feel their glutes, and we did start off like that probably a couple of years ago. Like I told you, like, dude, nobody can fire their glutes with a kickback. And then you were like, let me do the piston for people, which, we could show in another video where you're trying to hip hinge on each leg and start really getting that glute to fire. And people were struggling with that, but we got good results with it, right? But then we start looking up the chain and we found external obliques, or whereas another stabilizing area at the front of the hip, that, you know, the external oblique goes from your rib cage to the front of the hip, that they're lacking that tension on something like a simple body weight squat. And I've seen you show, you know, because I've been there on those assessments with you and some of our mutual patients and clients, and you've just taught them, like, press out into your obliques on the way down and just as far down as you can while keeping tension on the oblique. And it's like a quarter squat. Maybe it starts sitting back a little bit lower, but then they start going up and down like that with just their obliques on, and they're like, oh my god, my lower back doesn't go away, or my lower back doesn't hurt anymore. And I swear, this is one of my favorite examples. I was deadlifting with someone once at a gym, and I was showing them, like, go ahead and do your normal sumo deadlift or a normal conventional deadlift. Pick it up, drop it at the top. And they're like, nothing but erectors the whole time. They could just feel it. And I said, now do it with your old drill and Julian's old drill from that seminar. Press out into your obliques and pull the bar up with just the obliques. Just think about that the whole time and drop it at the top. And that person told me they felt better after that. They went from, like, only using their erectors to using their obliques and feeling better. And I was like, how in the world is that not all of the evidence that you need right there? You used a different muscle for the same movement that was hurting you. Now you're using the proper muscle to fire and bring you up on that hinging deadlift, and their pain went away right then and there with the same weight. I mean, it was a light weight, but I was like, still, that's even more telling, that because if you added more weight and used this muscle, you're way more protected from injury that way.
That's that, like, instant before and after is what I try to convey, is that show me how you do this deadlift, how you've been deadlifting for years or whatever you've taught, probably, and learn. And we had to go through this process of, now this is how I do the assessment. It's like, show me how you deadlift, Ian, right? Yeah. And then you'll do it, and then I want you to start to do it slower, and then so you feel what muscles you're using. And then pretty much everyone arches and tightens up because they were told to use their lats. And the other cue that they use is to do chest up. So when you start your deadlift, right, you pull into the bar and you go chest up. I can't, just how many times have we've all heard that cue, chest up. And so that's the definition of, like, using the wrong part of the core.
Can you imagine chest up and arms back and down at the same time? Just
shrugging up. Yep, and the reason I say that is because I went through the same thing. I used to coach knees out, external rotation, and all these other things through my 9.5 years of coaching CrossFit, and then realized it just doesn't work because I've strained my trap deadlifting. I don't know if you've ever done that.
I've had a teenage kid strain his trap on a hex bar deadlift.
And it's the same.
It's like, what? That thing is safer for you. And it was lightweight, and he's like, last rep, just shrugged it, because it's just natural. Everybody can do a shrug.
Chest up.
Chest up.
It's always the joint cue.
Dude, I gotta pee bad. The little girl bladder in me. Can you take it for a bit?
Yeah, I'll talk a little bit about.
Do a 2-minute hinge drill or interview Parker. I'll be right back. I'm the worst, dude.
So the big thing about the assessment for the hinge that I do is I believe that in low back pain, most people are using their lower back when they move, and they're not using the right core muscles. So when Ian is talking about the external obliques, it's hard to demonstrate in a podcast, but I'll make a little video about it on my Instagram and just show that most people will only probably need to practice this drill just to kind of buffer a lot of that 2 to 3 out of 10 low back pain. Because once you start using your external obliques to allow your hips to actually bend, then you don't have to use your lower back to bend anymore. So the goal is, when you do a body weight squat, when I'm assessing someone for that body weight squat, I have them fire their side abs. That's an easier way to kind of understand it. So try not to flex, the abs in the front, your 6-pack abs. Try to push your hands in at an angle into your sides and then flex as hard as possible. You good?
Princess is back.
I was just going over the hinge drill that I would use for the assessment.
With obliques?
With the obliques. So I'll have to make a video of it because it can get kind of confusing.
Yeah, I'm going to do the same with the kickback drill. I mean, people probably can't articulate that. I mean, our members definitely will. They've heard us preach it 1,000 times, but
the main thing is the point, right? Because, they're just there listening. We're just trying to give them the idea that there might be a reason why your back is hurting. And from what I've seen through my assessment is that they're bending at the lower back. And then the way that I would start to get them to squat better, because we talked about it, if you push your knees out, butt back, you're using the wrong muscles. Those muscles going up and down your spine, your erectors, and then you use your quads. So then what muscles are you supposed to use? That's probably going to be the follow-up questions. And from what I've seen, to simplify it, because once you get too deep into the anatomy and all this, people just glaze over and stop listening. And the easiest fix is to fire their side abs. I don't even call it obliques anymore, because no one is talking about obliques, and therefore no one understands what it is. So all I'm trying to get them to do is have them fire their side abs. And if you can keep your side abs on, you can push into it. I like that tactile cue, because
I love it.
If you can't flex it again, then you're not using them and you have no control of it. So flex your side abs. Those side abs should get tighter or flex more or flex harder as you start to squat.
Yeah.
And it should stay on through the full squat.
This is a lot easier said than done, because just recently with sandbag squats, if I grab a sandbag or a medicine ball and try to squat down, I used to say my arms are too short and this is the worst thing for me. But then you would tell me, squeeze your pecs together too to keep it tighter and all this other stuff, right?
It gets confusing.
It gets very confusing. So I use my pecs even, and I would still feel it in my lower back. But recently, probably within the last 6 months, the getting tighter on the way down, so I'd always go almost like a power lifter, press out into the obliques, pushing out into that belt, and then squat down and then come up with it tight like that. But I'd still feel in my lower back just because of the way that, my anatomy works and the way that I have very tight hips too. So what changed for me recently was that the oblique should be getting tighter on the way down, and then I kind of bottom out and then keep it tight on the way back up, and my erector pain has been gone, and I've been able to build on that with more weight, different movements, like my back squat feels a lot better now with that. It's easier said than done though.
There's members at the gym that have applied that to running as well.
Mm-hmm.
You keep your side abs on while you run. It reduces the rotation of your upper body. If you see people run and they're rotating at their upper body, going left and right, their elbows are traveling behind them.
We should post some pictures of that. I've seen it, still shots, and guys are looking left completely. Their whole body's rotated left, and their lower body's pointing straight ahead.
And that's how a lot of people run. I mean, you don't have to, you just look around a jogger when you're driving around, you see someone jogging. So
a lot of movement.
So then again, you go back to joint cues, which don't work, and you're like, hey, make sure your elbows are traveling straight back. Make sure your hands going, from cheek to cheek.
Yep.
Those are all joint cues. But no one talks about what muscles you're supposed to use to keep that core tight.
Yeah.
What muscles are you going to use to resist that rotation? And it's your side abs.
And just for people that are runners that are listening, a lot of movement lost like that, rotating around, and you're not firing those core stable muscles, you're losing kinetic energy that way, right?
So it's a performance dump.
Mm-hmm.
You're being inefficient with movement, so you're going to get tired.
Perfect word I was just going to say. Efficiency.
But two, if you are not using the right muscles, then which one are you using?
Exactly.
Your lower back muscles, your hip flexors, all the ones that are overdeveloped, the IT band issues, right?
Right.
You get all these
and that's why I show kickbacks.
Buzzwords.
That's why I show kickbacks throughout the day at work, because those dominant muscles are dominant for a reason, because you're feeding them all day long, right? So then you go to the gym or you go for your run in the morning or in the evening, they're on and they're going to stay on. So you got to give something else a stimulus.
And that's a good drill just to practice, because it's all a learning process, and you can pair the videos up after the podcast. But try to fire your side abs, and then try to keep them on when you're doing a squat, a run, and so that you're just testing, and see if you feel the difference. And since the body works in chains, when I do this squat assessment, when they come down into a body weight squat, I have them hold it. So they're just holding a squat at parallel, which means their hips are right at knee level. And I was like, okay, what muscles are you using? This is how you squat all the time. Because I didn't adjust their mechanics yet.
Right.
And then they were like...
No technique coaching
like,
it, right?
Oh, yeah. And I ran the class like that last week. And they're like, oh, some people felt it in their quads. Some people felt it in their glutes or hamstrings. Some people felt it in their lower back. And then I go, okay. Then I taught them what it feels like to fire their obliques, which is side abs. And then right when they did that, the people that felt it only in their quads started to feel it in their hamstrings because the mechanics are right, you know? So you can try to...
They probably never felt that before either. They're like, whoa, what in the world?
And it's weird, right? Because it's not like saying I'm trying to get them to fire. It's just that their hips are moving finally, not their lower back.
Yeah. That's really good stuff, man. I mean, it seems simple, but it's really not.
It's simple, but the problem is everyone wants that fucking quick fix. That's why they're on YouTube. That's why those videos have 1 million views. Is they're like, shit, if I do this quick, it's in the label, it's in the title, I'm gonna do this quick stretch. And unfortunately, they will get the return they're looking for because the pain is gone for that temporary fix. You do a stretch for the hip flexors, and we've used it, we still use it for recovery. You do a hip flexor stretch, then your lower back will release. But it doesn't actually fix the way you move. So the back pain's gonna come again. So if you wanna just do hip flexor stretches the rest of your life for hours on end, then by all means go do that.
Right.
You know? It is simple of learning how all this works, and that's our goal, is to share it. Because we can't reach everyone. I don't have time to do one-on-ones with everyone. That's my whole purpose of the Instagram page, is I'm going to do a lot of live assessments, and I'm not just giving you that, like, this one drill. I'm going to walk people through my whole assessment and how I'm fixing each special or unique case, you know? But once you understand that, that is easy in my opinion. The hard part is you have to fucking do it. Like, the main thing I tell people once they do an assessment, they're like, what should I do next? What drill? I was like, okay, since this is such a deficient muscle, which means it doesn't work or you can't even flex it, like the glutes, well, guess what? You're going to flex this thing all day long.
You know what's interesting is, I was just thinking this earlier, I'm glad you brought that back up. Everybody so badly wants a rep scheme, right? So I tell people, like, yeah, do these kickbacks 5 to 10 reps per leg at least 4 to 5 times a day, if not every hour of the day. And when I have them stand up and do them, they rush through it, kind of like you were talking about earlier. Like, people just want to get through the reps so fast because they're just trained that way. Like,
it's
maybe
like taking pills. They want, like, how many pills should I take? What hours?
We're so trained like that, right? Like, if I take 2 to 4 Advil every 4 to 6 hours, it will knock down my pain. If I do these kickbacks every 4 to 6 times a day, it should take care of my lower back pain. It's not that. And that's something we had to find out with FixFit, was that people so badly said, Mark, this ab wheel feels good. So should I do the ab wheel 3 by 10 every other day then? And you're like, no. Like, it's not some rep scheme that's just going to fix your life.
It's not, and the goal is to fix the back pain, right? And then we found the problem. The problem is that you don't use your obliques, right? That's the whole issue, or your side abs. And why don't you use it? Because you're an engineer, you're an accountant. You sit at your desk with these muscles turned off. You're rounding at the back, at the spine. So you're not using them all day long. And
right.
and you think that you can just be inactive. You sit with shitty posture or whatever, and then you come into the gym and you're about to hit a PR deadlift. And then you have some magical way of turning on the muscles you haven't used for 10 hours sitting. It's like, that doesn't happen. But the people that have had success fixing their issues are the ones that go, oh my gosh, I was walking my dog and I kept my glutes on.
Yes,
and they're like, oh fuck, my lower back's not as tight after I jogged with my dog. I was like, there you go. What kind of I can't give you that fucking rep scheme. Like, you're doing these things. I showed like a pec and teres flex posture tangent because I brought it up. There's so much shit on posture, and then you use a joint cue.
I was just gonna say, how many patients I have that just go, I have bad posture. I have bad posture. It's like, we all do. It's just like core.
But also,
I work on my core. What is your core? What is posture?
What exactly? Define posture.
Define core.
I don't know. Shoulders back and down. You can pull your shoulders way back and way down, and you're fully overarched in your lower back. So is that good posture?
I have a strong core. I work on it all the time in the gym. But is that core translating to walking your dog? Is that core translating to sitting 9 hours at your computer? No, then your core wasn't efficient. Your posture's not efficient. And what we're trying to say is you have to give it that different stimulus all the time. So you need to, one, be cognizant of it. So I tell patients all the time, the fact that we just talk about it like this, the fact that you're listening to this podcast, you'll start thinking about it a little differently, and your body will adapt.
You see movement in a different light.
Yeah.
All we're doing is moving better. And I tell the people I assess is like the push-up, for example. I did a push-up video on Instagram with Amanda, and then she says she has to do push-ups for Krav Maga and stuff like that, and she's dealing with a shoulder injury. So I say, hey, you know what? You're moving. You're doing a push-up, a pushing pattern for the shoulders. You have two choices. You're going to do this push-up anyways. You can either push up with your traps and your front shoulder, or you can use your pec and teres and obliques or whatever, right? So same with posture. You're sitting upright at your desk. We're walking around at the store. Something's got to carry your head, the weight of your torso, your shoulders. So you have choices. You can either use the right muscles or the wrong muscles.
Also, what we say too is, like, for example, I had a guy with stenosis in his neck, and we're like, all right, use this movement and use this movement to flex your pecs and teres, and it would go away. These neurological symptoms would go away with that movement. And what I told him was, obsess over it. I've stolen that from you. Just like the kickbacks, just like your core, you're keeping your obliques on. Obsess over it. Do it all day long. Always think about it, at least, to change your perception of how you're moving, but also to feel it. And then if that starts carrying over into some long-term benefits, very good. But two, this is another thing you and I always say, how long have you been moving incorrectly? So your entire life, you could be 14 years old, you could be 44 years old. You've been moving imbalanced your whole life, giving it different stimuli with different sports and movements and exercises. So if you're going to give it a new one and you expect it to work, it's not going to just change its time overnight, right? So, I mean, if it does, great, but is it going to last? No. And they ask, well, then how long is it going to take? And I always just tell them their age. Like, if they're like, I'm like, how old are you? I'm 30. It might take 30 years, man, because you've been moving bad for 30 years. Maybe it's going to take 30 years to fix it.
I always go, as long, you have to put in the work. So
right.
That's how long it's going to take until you figure it out. What we're trying to do is educate people, and you have to learn.
Yes.
So the reason why I say obsess over it,
yep.
If you have to learn anything and to become decent at it, just decent at it, you have to obsess over it. Think about if someone that's, like played any instrument, or like you've done jiu-jitsu or basketball, anything that I've tried to be good at, I've obsessed over it. I would play like a pickup game basketball, and then right afterwards, I'm like, shit, I should have done this, or shit, I should have done that. Or now in jiu-jitsu, I'm like, I roll with someone, or I learn a new technique. I'm watching YouTube videos. I'm thinking about it all the time.
And who's successful at sports? Who's successful in weightlifting and PR? People that practice and do it every day.
And they think about it.
Man.
Because they want to get better at it. So let's take away the sport application, but now we're just trying to fix your lower back.
Yes.
It's like, I have low back pain. Well, you're going to live, and you want to live the rest of your life without low back pain, right?
Yes.
So you have to fucking learn it. Give me reps and sets.
Yeah.
You're not learning jack shit. You're following some protocol or template, a piece of paper that says this is going to fix your back.
Even if we gave you programming, we'd be like physical therapy if we gave you programming and said, do this for the rest of your life.
You get the discharge packet.
Yeah.
And it's like, well, if you do these movements wrong because you didn't understand the mechanics, or you didn't learn the mechanics, or you didn't learn which muscles you're supposed to use, then it's all for nothing.
Or people think they're fixed, I'm out of pain, I'm moving better, and then when they do get that little signal of pain, they go, I'm going to go get adjusted again, and then I'm going to dust off that packet and do some of those stretches again, and it'll go away. It's like, do you want to be in that constant cycle of rinse, repeat, rinse, repeat? I do like doing tune-up adjustments to people, but I'm like constantly asking them, like, where's your goal now? Right? Like, oh, you're feeling a lot better. Do you want to run a half? Do you want to run a 15K? No, don't worry. Okay, what do you want to do? Well, I want to join this gym, but I'm a little hesitant. Perfect, go join it. Go apply everything I just told you into something that you want to do. And if you just want to live out of pain and just do these exercises all the time, that's fine too. But even if you're walking your dog or playing with your kids and you enjoy that, you should still be applying it to that. And we hope to get wins in all those categories.
And I think that's where we're at, where you and I obsess over it for our profession. right? It's because I believe, again, we should do better. It's just like, as a CrossFit trainer, right, or a jiu-jitsu coach, or if you run a small business that's membership based, you should obsess over it, because you don't want someone to have low back pain and then take a break or not sign up.
Yep.
Or then you're labeled at like, oh, they teach the deadlift improperly and I keep hurting my back at your gym. So you have to obsess over it and you have to figure it out. It's even more important for those that are teaching people movement, or like healthcare practitioners like you guys, or massage therapists, right? It's just like, you don't want, I mean, for you guys, your style is you don't want to see them like, 5 times a week, 3 times a week, and then lock them into some
That's
plan.
my thing is my idea of maintenance isn't coming in and getting adjusted once a week just for the fun of it.
Thing. Yeah.
Right, yeah.
The fun of it.
The fun of it. It's so fun. And my office is pretty fun. But at the same time, it's like, if you come to me every single week and say, it's still hurting, you're driving me insane.
Yeah.
Right? So it's like, it's funny because at your gym, if a member was hurting and they wanted to take a break, that's loss of business, that's loss of them doing anything, and they could be lost in some system of, I went to my MD and he told me to rest. For me, they just keep coming and complaining about it. So as a practitioner, if you're listening to this, it's like, aren't you sick and tired of that? Hearing that? I am. Like, if I have a patient that I'm seeing, like, people come in all the time and it's like, January, all right, I got 20 visits for the year, how am I going to spread this out? And I just go, oh my gosh, like, you got to stop thinking like that. That's the healthcare model, right? I don't want to see you 20 times. Like, honestly, some people, I don't want to see you 20 to 30 times. No offense. But it's more like we're spinning our wheels and I'm getting exhausted of 20 to 30 times you're coming in saying the same thing over and over again. Because that's the definition of insanity, right?
At the base of it, our main goal, we do what we do because we want to help people.
Yes.
We're not helping people anymore. So if you're now coming from a membership-based business like a gym,
Chiro offices do it. You know it.
And it's like, wouldn't you want to not lose your member? And they'll fall into the system if they have a back injury or pain, and then you can just give them like a stretch temporary fix, and then they go PT, or then someone's telling them not to do it, or the member comes to their own conclusion saying, oh, it is too dangerous, I'm too old for this.
CrossFit hurt me, or chiropractic didn't help me. Those are the two things we keep hearing. And it's like, aren't you, like, if you are a CrossFit owner or a gym owner, or you are a chiro or a PT, aren't you tired of hearing that stuff?
And we go through that, and again, we have to obsess over it. That's the whole point. Is now the education begins, but then also the education has to, a part of that education you have to put the responsibility in their shoulders too. Because I can't go like, oh man, we do FixFit here, you're never going to get hurt. Well, no, it's not the point. It's that we're giving you the best education and about mechanics that we know now. Things will change again. And then our members used to go, oh my God, you taught me this wrong for so long. I did. But again, that's as much as I knew at that point, right?
Yeah.
So we're just evolving, like the next
constantly
update.
Evolving.
The next update on an iPhone. I always joke around. It's like, yeah, I did teach you that, but that was like an iPod Nano. That was a Razor flip phone. if we got that shit right the first time, we would still, but we're changing. We're at an iPhone 10 or whatever, X and some shit.
That's awesome.
That's what we're doing, is that this is what you get. But obsessing over it is on their shoulders, like nutrition.
Yep.
You can take 50 nutrition seminars and follow some damn protocol, but then if you don't do your work, you don't meal prep, or
it failed you.
Yeah, it failed. It's like, oh, that didn't work.
The keto diet didn't work for me. This diet didn't work for me.
You didn't fucking work. You have all the resources. If you're listening,
that is such a good point.
Once you have the resources, you have to do the work.
That's a great point, dude.
And that's on me too. If I just ran hard and then I hurt myself, and then I just rest, and then I run hard and hurt myself, whose fault is it? Is it the running? Running's bad for you?
I just think that both of us are not trying to say that FixFit is the fix-all, right?
It's just education,
It's
bro.
education. It's a different way of looking at your health.
It's the shit that worked for us.
Right.
That's all we're sharing. Again, because we just shat on stretching for so long, right? For like an hour, we're like stretching this. If stretching works for you